Well, as I said earlier, October being the Cancer Awareness Month, on set here we have Catherine Nyongesa. She is a clinical oncologist with an experience in cancer treatment. She's also currently the head of department at Kenyatta National Hospital Cancer Treatment Center. She's here to enlighten us on what to expect during this month Cancer Awareness. Thank you so much for finding time.
Thank you.
All right. Probably you can start with telling us what to expect during this month's cancer awareness.
October really is a month where we create awareness in all the cancers, but with a special focus on breast cancer. And during this period, we create hope for those who are affected by the cancer. We also celebrate and admire the victors who have gone through the breast cancer treatment and are living. And we also create awareness to the members of the public so that in case they notice anything, they can go for early checkup, screening, and early treatment. Yes.
And Catherine, you know, this being the Cancer Awareness Month, are we only focusing on breast cancer because we have other types of cancers? But most of the time, most people imagine that, you know, breast cancer is a women's affair thing.
It's not. Okay, special focus is on breast cancer, but we always take this opportunity to also screen for other cancers. And also it's a time where we remember the ones who have lost a battle to the cancer. And cancer can affect both men and women. And breast cancer in our society occurs in about 1 to 3% of the men, but the majority are women. Yeah.
And you know, just coming back to the same question, you saying that cancer can affect both men and women, but currently we see that breast cancer is more prevalent in women. Why is that so?
One of the reasons is that women have more breast tissue. The second is the hormonal changes. They are quite prominent in women. The other risk factor could be because of the genetic inheritance from maybe if you have close family member what has breast cancer. And there are certain cancer-causing genes which are commoner in women than men. And then apart from that, there are some things that you can control. For example, if you get children, you are encouraged to breastfeed your children. That protects you against breast cancer. Also, having your first baby before the age of 30 is protective. Having more children is protective. There are things you can also not do anything about, and one is the fact that you are a woman, and the other fact is that as women, we grow older, the risk of getting breast cancer increases. Yeah. And
you know, there are so many misconceptions about cancer. Probably you can share with us maybe some of these misconceptions, especially in Kenya.
So one of the biggest misconceptions is that when a woman has breast cancer and she's operated on, or they take a biopsy just for diagnosis, they always think the cancer will spread. That is a myth, and operation or surgery is a very good treatment for breast cancer, and it can actually save lives and cure the patient. The other misconception is that when one has breast cancer and they undergo mastectomy or removal of the breast, they think it's an automatic sentence to death. That is not true. We have long-term survivors. So long as the surgery is performed well, you can live a fairly normal life despite the challenge of breast cancer. Yeah.
And Catherine, let's talk about Texas Center, where you're also working in. How is it connected locally to patients, and how are they able to access the Texas Center?
So Texas Cancer Center, we have two main branches, one in Nairobi off Mbagathi Road in Madaraka, and the second one is in Eldoret. In terms of connecting to the patients, we offer affordable treatment to cancer patients. And now we are even using the National Hospital Insurance Fund for the treatment. And NHIF has offered a lot of relief to patients, especially on finances. We find majority of the patient who would not otherwise afford treatment, it is affordable. We offer chemotherapy and radiotherapy, which is a very vital treatment in cancer of the breast and other cancers in general.
And you know, many patients cannot afford the treatment of cancer in Kenya, probably because of the lack of affordable facilities. And bearing in mind that this is a dreaded disease, do we have hope for Kenya to see that in future all of us or everyone can access cancer treatment?
There is a lot of hope. As we speak, we are actually negotiating, our government is negotiating or it's collaborating with the International Atomic Energy Agency to put up cancer centers in 4 more counties.
Yeah.
We are talking of Eldoret. Actually, machines are starting to trickle in Eldoret. We are talking of Kisumu County, Nyeri, and Mombasa. These are government projects, they are international projects. They will take time to materialize, but there's a lot of hope. And at KNH also there are plans to put up a cancer center of excellency, and we require about 4 billion shillings to make this dream come true. So it is a heavy investment, and also we need to encourage people to go for screening, because as much as you may have a healthcare facility, but if you go late for your treatment, then the chances of cure are reduced. Yeah.
Probably as we and maybe you can talk to people who are shy to probably do a clinical screening that is due to maybe time or the cost and lack of health awareness. What do you tell them during this month's cancer awareness?
Actually, like for Texas Cancer Center, we're going out in the counties to do screening. And the surprising thing, the statistics are shocking, that we actually see 60% of the turnout being women. And the men, the turnout is very low. And we encourage everyone, be it a man or woman, to go for screening, because early screening, early detection of cancer can really save lives. And the fact that if you have symptoms that are not going away, even simple symptoms like flu-like symptoms, some lumps on the bodies, growths, some discharges, maybe you are swallowing food is stuck, or unusual pain, unusual weight loss, have a checkup for cancer.
All right, thank you so much, Catherine Nyongesa, a clinical oncologist, just telling us that the best protection here is early detection, as we look forward to this month's cancer awareness. Up next is sports. In just a few minutes, we will be back shortly.